الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Hydatid disease by Professor Mahmoud Hani Sulaiman. Key features: zoonotic parasitic disease transmitted between dogs and domestic livestock, particularly sheep. Human cystic echinococcus is in parts of the world where sheep are raised and dogs used to herd livestock. Liver is most common site of echinococcal or hydatid cyst. Then lungs cysts occur less frequently in spleen, kidneys, heart, bone, and CNS. New sensitive and specific diagnostic methods and effective therapeutic approaches against cystic hydatid disease developed in last years. Treatment include surgery, chemotherapy, antihelminthic agents, or puncture, aspiration, injection, re-aspiration, the latter being restricted to treatment of liver cyst. Despite some progress in control of echinococcus, this zoonosis continues to be a major public health problem in several countries. In several others, it constitutes an emerging and re-emerging disease. We'll give lesson at the end of zoonosis, at the end of infectious disease about emerging and re-emerging disease. Organism: Echinococcus granulosus, a cyclophilidian tapeworm of canines. Cystic echinococcus is infection of humans, mammals, by larval stage of zoonotic cystode, Echinococcus granulosus. It is also known as cystic hydatid disease. Transmission: eggs pass in dog feces, contaminate land, then eaten by sheep, pigs, goats, cattle, camels, and horses, which will lead to hydatid cyst. Next figure. Hydatid cyst is a fluid-filled sac containing a numerous number of scoliosis, any of which can become an adult worm in dog. Common means of infection is dogs to be fed offal of domestic animals. In the wild, jackals, wolves, and wild dogs become infected by killing and eating infected herbivores. Humans enter this cycle accidentally by swallowing eggs, either in food, e.g. fruit, vegetables contaminated by dog feces, drinking water contaminated by dog feces, close contact with dogs, e.g. touching their fur or being licked by dogs. When a dog licks itself, it can spread eggs all over its body as well as sticking to its tongue. Primary infection commonly occurs in childhood with symptoms developing in adult life. This is the life cycle. The dog excrete passed in dog feces, eaten by sheep, then sheep eaten, and the dog eats infected animal offal. And if accidentally the human swallowed the eggs, it will cause disease in the human. 66% in liver, 10% in lungs, 8% testes, and 7% renal. This is the life cycle of Echinococcus granulosus. There is a life cycle in man, life cycle in sheep, life cycle in carnivorous. This table is very important. It shows infections transmitted to humans from dogs or in which the dog is a reservoir. Anyone work with or live near dogs is exposed to these diseases. So it is work-related disease and environmental disease. It is so important to prevent these diseases in dogs and prevent their transmission to humans. Of course, this is mainly duty of the owner. Please tell your patient who has a dog or cat about how harmful his dog or cat and how to prevent these diseases. Easily to take his dog or cat to the vet and ask him to prevent these diseases. Hydatid sand Fluid aspirated from a hydatid cyst will show multiple photoscolysis. Multiple photoscolysis. Size about 100 micron, each of which has typical hooklets. The protoscolyses, which are normally invaginated to the left, evaginate middle then right when put in saline. Incubation period several years. Period of communicability. Dogs are often repeatedly infected, so continue to be a source of infection, especially to children. Occurrence and distribution. Widespread but occurs in pockets as sheep rearing areas. Sheep rearing areas where dogs live in close proximity to humans. A very high rate of infection is found in Turkana people in Kenya, where dogs are trained to care for young children. Clinical features. Hydatid cyst, intermediate stage of parasite recorded from all parts of human body. Commonest liver, lung, abdomen, kidney, brain in descending order of frequency. As cyst increase in size, serious problems, sometimes fatal. Cyst contents are infective, so if it ruptures either accidentally or at operation, then numerous new cysts are formed. The liberation of so much foreign protein in body can result in severe anaphylactic reaction. This is the photo shows abdominal distension from hydatid cyst in Turkana in Kenya. Diagnosis clinically from enlargement of liver or discovery of cyst on chest X-ray. Immunological methods are useful. A diagnostic aspiration of the cyst must never be made. These are two chest X-ray. On the left, a chest radiograph of young male with multiple cysts in right upper lung field. Right upper lung field. And large cyst on right lateral chest wall. Right lateral chest wall. B. Chest radiograph of almost 4 years later, after 4 years of the first X-ray, following prolonged course of mebendazole therapy. Mebendazole therapy. No lesions are present or radiograph free. Cystic hydatid disease. A shows CT scan showing septate densities in a 12 centimeter cyst. 12 centimeter cyst with septa. Sonogram. B. Sonogram of same cyst showing septate densities. C. Daughter cyst removed from the same cyst. Management of cystic hydatid disease caused by Echinococcus granulosa should be based on visibility of parasite, which can be estimated from radiographic appearance. Ultrasound appearance includes lesions classified as active, transitional, and inactive. Active cysts include types CL, in coming slide this will be shown, with a cystic lesion and no visible cyst wall. CE1 with visible cyst wall and internal echoes, snowflake sign. CE2 with visible cyst wall and internal septation, coming slide. Transitional cysts, CE3 may have attached laminar membranes or may be partially collapsed. Inactive cysts includes type CE4 and CE5. This is the CL, CE1, CE2, CE3, CE4, CE5. This is cystic lesion, active, transitional, and inactive. Prevention and control of hydatid disease. Implemented at several points in life cycle. Infected material not fed to dogs, or it must be well cooked. Dogs treatment by praziquantel to remove any adult worms. Measures taken to decrease fecal contamination as fencing water sources and food gardens or general training of dogs. Prevention continued. Ultimately, zoo control will depend upon human attitude to dogs by keeping them in an appropriate place, and this is also for cats. Not touching them or feeding them at meal times, destroying unwanted animals, and observing personal hygiene. Children in particular should be taught to wash their hands before eating and after touching dogs or cats. In endemic areas, echinococcus is prevented by administering praziquantel to infected dogs, denying dogs access to infected animals, vaccinating sheep, limitation of number of stray dogs and cats is helpful to reducing prevalence of infection among humans. Treatment: albendazole and mebendazole are effective when necessary. Surgical removal may be required, taking care to remove entire cyst, or if rupture seems likely to sterilize contents with formalin. Praziquantel will prevent development of secondary cyst if rupture of primary cyst took place, so it is useful precaution during surgery. When doing surgery, this must be given to the patient. وفي النهاية أقول الحمد لله رب العالمين الذي بنعمته تتم الصالحات و thank you.